Louisiana has joined a growing number of states, creating the position of Surgeon General. Governor Jeff Landry appointed Dr. Ralph Abraham to the role earlier this year. Now, in this week's Louisiana Speaks, I sat down with Dr. Abraham to talk about his new title and how he hopes to improve Louisiana's poor health rankings. I am joined by Louisiana's newly appointed Surgeon General, Dr. Ralph Abraham. Thank you so much for joining us here in studios.
Glad to be here.
So viewers, this is a new role that was created, and I think the first question that viewers want to know is what exactly does a Louisiana Surgeon General do?
When Governor Landry got elected, he envisioned this role, teamed up with the legislature to create the role of Surgeon General. LDH, the Louisiana Department of Health, is a large organization. Medicaid, water, public health. We encompass many entities. The governor's vision, along with mine, was that we needed a Surgeon General to bring all agencies together across the state, whether that be hospitals, boards, physicians, communities, to pool resources for all of Louisianians to make their health better, to improve our health outcomes. Unfortunately, right now, Louisiana is not doing well in national rankings, and we intend to improve that.
So let's talk about some tangible ways that you're going to come in and do that.
Right. We need our people healthier. My job as Surgeon General is to find the means to make that happen. We just came from a huge meeting of Louisiana doctors, met with them, got their input. We've had many meetings with our hospital systems. What are their best practices? They all have areas that they are experts in, and we want to pool those, connect those dots, and move in the direction that we know we need to move in.
So what can Louisiana do at the policy level to improve health outcomes?
Policy is where the rubber meets the road, literally. We can blame a lot of things as to why we're not doing well, but health policy, to your point, is the key. We've got to put policy where we are looking at the causes of why our chronic diseases are bad, why our maternal mortality and morbidity is not well, why our infant mortality and morbidity is not well. We have had conversations from the national level to the state level to the local level as to what we need to do, what exactly it is that can move that needle, and we're learning very quickly that it's going to take resources, it's going to take commitment, and it's going to take community buy-in, which we've got.
So in order for Louisiana to improve its health outcomes, clearly at the policy level there needs to be a component of social services, support for people that are economically challenged, that don't have the resources to good food, good health care. Do you see that as a challenge in your position to push for social policy to improve outcomes?
Absolutely, it's a challenge, but we're meeting the challenge at LDH. We've got those people in place. We've got those experts that know how to address those issues. We are asking that if they need help, call us, call me.
And the resources are there?
They are there, yes, and they have been there. Unfortunately, I think we've been lack in history of the LDH to advertise all that we have available. And we are making light speed changes to ensure that people know how to reach us and how to reach out.
What is your personal priority? What is the most important thing that you would like to tackle in this position?
There's not just one, but the thing that comes to the top, I think, is mental health. We struggle every day in America, not just Louisiana, with this mental health crisis. The governor and the legislature just came off a very successful crime session. I know as a physician, they knew as legislators, and certainly the governor and I have had this discussion more than once, that many people that are arrested have a mental issue. And if we can intervene before they commit that crime, we've not only helped that person, but we save the state a lot of money too. So it's a win-win. So mental health for sure. Children, of course, are near and dear to all of us. And I see them in families that are struggling just to meet educational needs. A child cannot learn if they're hungry or if they're unhealthy. And again, that's my job as Surgeon General, to find those agencies, if we don't do it at LDH, to provide those resources for those children, for those families.
So the requirement for this position is that the individual is a medical doctor.
Correct.
You are a physician.
Right.
Tell us a little bit about your background.
I grew up in rural Louisiana. It's still where I live. I grew up as a boy there. It's where I practiced medicine. First, I went to veterinary medical school in Baton Rouge right here. Practiced veterinary medicine for 10 years. Saw that there was a huge need for access in the rural community just to see a doctor. I said, well, maybe I can do that. So as a mid-30s gentleman, I went back to medical school, was fortunate enough to get in. Came back to the community that I live in, and that's where I practice medicine.
All right. Well, thank you so much
Thanks
for joining
having me.
us and introducing yourself
Yes,
to
sir.
our viewers, and welcome to your new position.
I'm going to look forward to it.